Welcome into News Channel 11 at 5:30. I'm Sarah Diamond. Josh is on assignment. I'm joined live in our studio by Dr. David Kirschke from the Northeast Tennessee Regional Health Department as we continue our monitoring the coronavirus, asking the experts. Dr. Kirschke, thank you so much for joining us.
Sure.
We have a lot of information to get to. We want to get to as many questions as possible. First of all, we want to point out that the Virginia Governor, Ralph Northam, closed K-12 schools in the state for at least 2 weeks. What are your thoughts on that move right now?
Also, I can't speak to Virginia, but in Tennessee, we've been talking with our school officials quite a bit. Really, the trick is getting the right balance. You don't want to close schools too early, especially if we're going to have to close them for extended periods of time later, because then, you know, all the parents have to burn sick leave and babysitters and things like that. So
yeah,
we're really working on the right balance, and CDC has put out some new guidance about, you know, when is the right timing to do that. So we've been in discussion with education officials about trying to get the right timing.
It seems like it's a delicate balance. You don't want to do it too early, because then if more time needs to be on the tail end,
right, exactly,
then that's even more time that kids
and
are going to be out.
It looks like it's more important to be out when you have widespread community spread of the virus.
Okay. And also, we just heard from Ballot Health moments ago about putting some strict limitations on visitors in hospitals. What are your thoughts on this?
Yeah, so we encourage healthcare, you know, whether it's long-term care or hospitals, to try to limit spread, especially to high-risk people. So people that are in the hospital are going to be higher risk, elderly, people with medical problems. So it's definitely reasonable for them to screen people for symptoms and keep them out and limit visitors.
A lot of people, of course, on social media talking about this. There is a kind of a new buzzword and with a hashtag, and it's called Flatten the Curve.
Yeah.
And it's an effort to cut down kind of on the spike of cases of COVID-19, like Italy is experiencing right now. Why? And it seems pretty common sense, but tell us why this is so important to flatten this curve.
Yeah, so if everyone gets sick all at once, if we don't do all these community measures we're talking about, like especially personal things like wash hands, stay home when you're sick, if it spreads very rapidly, then our whole system gets inundated. So hospitals get flooded and overflowing, like sometimes with really bad flu years. You know, a lot of people out of work. So just day-to-day things get shut down. And then supplies also of personal protective equipment for healthcare workers run out, and you can't resupply. So, you know, the more we can spread it out over a longer period, the more controlled we can have, and it's just more recovery time in between cases for everybody.
That is true, and you can see this is a great graphic, that steep curve, that's with the cases,
that's what we're talking
the spike
about.
of cases.
Yeah, we want to flatten that out and extend it over a longer period of time, and it gives everyone better chance to respond
and to deal with it. Yeah. Okay, we've heard this virus is not as dangerous for our younger people, which is great news, but the concern is not just for our young people's well-being. We have a lot of other age groups that we need to worry about as well. It can become really dangerous for our loved ones who are in the older age groups, people whose immune systems are compromised. So it still can be dangerous if kids are going to be around their older loved ones.
Yeah, for sure. So we know a lot of grandparents are taking care of kids now too, so it's definitely a concern. And it even comes into play with closing schools. If we close schools, a lot of times those kids are going to go home and stay with grandparents and things like that. So that all has to be taken into account when we talk about closing schools. But for sure, one of the reasons further on in the outbreak, when there's widespread circulation, that we would close schools would be to try to limit some transmission among children, who then can pass it on to the rest of the community.
We hear a lot of cases of people who are infected experiencing what some are calling mild symptoms. But there's a question of what exactly is a mild symptom, and it can be different for different people. Can you kind of define for us what the mild symptoms of this would be?
Yeah, so we think that about 80% of people that get coronavirus would have mild illness. Some may not even have any symptoms, but so mild would be low-grade fever, you know, some body aches, but you can still, you know, you're not bedridden, you're not stuck in the bed. You
still function.
Yeah. Hopefully you're not going to work, because we recommend you don't go to work or school. But you know, you can still be up and around doing stuff, so that would be considered mild. We think another 20% So 80% would be mild, 20% would be more severe, where they might have to present to health care or even be hospitalized. So that's a big number. That's another reason to flatten the curve, because if 20% of our whole population gets sick in a small amount of time, that's going to be a lot of people going to the emergency room or the hospital.
That is true. Okay, Lisa sent in a question. Does this virus affect animals like our indoor pets, dogs, cats?
Yeah, so CDC says that they don't think either that your pets can get sick or can give it to you, but we still don't know enough about the virus. So they are recommending that if you are sick with coronavirus, that you avoid contact with your pets just like you would with your family members, because there's still some information not out there, but we don't think it'll either affect pets or you can get it from your pet at this time.
That is good news. If we're feeling under the weather, we like to, get a good snuggle with our pets. It makes us feel better. So hopefully that won't be the case. We're going to continue our discussion with Dr. David Kierschke after the break. We have more viewer questions being answered as Monitoring the Coronavirus, Asking the Experts continues on News Channel 11 at 5:30. Stay with us.